Hi, my name is Camille from Pareto Education, and in this video, I'll be doing a short explainer on how to consent a patient for a gastroscopy, also known as an OGD. Before consenting the patient, ensure you fully understand the procedure yourself and can potentially answer any questions the patients may have. In good medical practice, the person performing the procedure should ideally consent the patient. Ensure you are speaking to the correct patient by checking at least 3 identifiers: name, date of birth, NHS number, address. We can split this into a few sections, which I'll explain now. Firstly, indication. Why is the patient having this particular test? Why is they having the OGD? Practicalities. During the test, what happens? Where are they? How long does it take? How big is the scope, etc. Benefits. Why should the patient have the test? The patient should understand this. Risk profile. This is very important. The patient should understand the risks involved with this procedure. Any preparation that the patient must do at home before the procedure and even prior to the procedure starting. Then after the procedure, is there any aftercare involved? The last thing to inform the patient is safety netting advice. Inform them of any red flags, anything worrying that they should seek medical attention for. So for a gastroscopy, the indication for this is investigating potentially a bleed, potentially symptoms of dysphagia, potentially an ulcer, any strictures, and also things like surveillance for varices, taking biopsies for iron deficiency patients. Practically, we have to inform the patient what will happen during the procedure. Practical elements. A gastroscopy normally lasts around 15 minutes. It's a long, thin tube that goes into the mouth with a camera attached and also other instruments to potentially take biopsies, seal ulcers, insert clips. It's normally done with local anesthetic at the back of the mouth spray. Often patients are also given sedation to tolerate the camera test better. This is often in the form of midazolam or fentanyl. The benefits of gastroscopy are twofold. It is diagnostic and also management. Diagnostic, we can see any problems within the GI tract from the mouth up to the level of the duodenum. We can also treat the patient as well. Perhaps there's an ulcer, a bleeding ulcer, we can treat that with clips, adrenaline, other interventions. As with any procedure, there are risks associated with gastroscopy. These include injury and perforation, meaning a small tear, introducing infection, and also bleeding, which are the common risks. Preparation. If it's an outpatient procedure, patients are requested to stop antacids a couple of weeks before their procedure. We ask the patient to be nil by mouth. This will allow the endoscopist to visualize the stomach without food in the way, obstructing the view. Post-procedure, we ask the patient to be with a family member or a friend who can take them home. No operating heavy machinery for 24 hours as the effect of the sedative wears off. In terms of safety netting, if the patient is in severe pain, abdominal pain, there's severe vomiting, or there's blood in the vomit or the stool, they should seek immediate medical assistance. Ensure for the consent to be valid, ensure the patient has capacity to consent to this procedure. And you can remind yourself of the important principles of capacity by watching our video. Thank you very much, and there are important references as always in the description, and we'll see you in the next video.